Timmy was playing in his backyard on a sunny afternoon when he accidentally disturbed a bee's nest. One of the bees flew out and stung him on the arm. Timmy was scared and started crying. Timmy's mom was watching from the window and rushed outside to help him. First, she removed the stinger from Timmy's arm using a credit card. Then, she had him wash his arm with soap and water to clean it. Next, she applied a cold compress to reduce the swelling and pain. What happens when you get a bee sting? When a bee stings you, it leaves behind a small amount of venom, and this venom can cause pain, swelling, and redness in the area where you are stung. Timmy's arm started to swell and hurt, and you could see a red bump where the bee had stung him. Honeybees, which are also known as Apis mellifera, are key crop pollinators which are found throughout the world. Adult humans have been stung by bees for thousands of years. Adult humans can withstand about 1,000 to 1,500 bee stings, and children can withstand less depending on their weight. On average, humans can withstand about 20 bee stings for every kilogram, or 10 stings per pound of body weight. Let's take a closer look at the bee stinger and the bee venom. The bee stinger is a modified ovipositor and is primarily found in female worker bees. Upon stinging, the barbs anchor the stinger, causing it to remain embedded in the skin. The bee venom is called apitoxin, and it is contained in a sac that pumps the venom into the wound. The bee venom has several components. Melittin makes up about 50% of the venom. It is the major allergenic peptide that causes pores to form in the cells, which leads to pain, inflammation, cell lysis, red blood cell lysis, and in severe cases, rhabdomyolysis. Other components include adolapin, mast cell degranulation peptide, which causes mast cells to release histamine, apamin, which affects the nervous system, histamine, which amplifies swelling and local reactions, adrenaline, which is a fight-or-flight hormone, and phospholipase A2, which disrupts cell membranes. Local reactions include pain, swelling, erythema, histamine release. Systemic reactions include mild urticaria and angioedema. There is also IgE-mediated hypersensitivity, which is when an allergic response occurs that can lead to severe reactions. The most severe reaction is known as anaphylaxis, and this is when there is difficulty breathing, swelling of the lips, tongue, neck, face, or throat, dizziness or fainting, abdominal cramps, nausea or vomiting, cardiovascular collapse, which could cause blood pressure to decrease, bronchospasm, which is the closure of the lung passages, laryngeal edema, or swelling of the airway. Diagnosis and management. In a skin prick test, bee venom is injected into the skin. This detects immediate hypersensitivity. Allergy blood testing is also called radioallergosorbent test, RAST. This measures the specific IgE antibodies against venom. RAST testing is useful for patients who cannot undergo skin testing. Emergency treatment. Anaphylaxis is managed with epinephrine, which is also called adrenaline. The autoinjector provides intramuscular or inside the muscle dosing. This is usually 0.15 milligrams for children 5 and under, and 0.3 milligrams for adults and children who are 6 and older. Healthcare professionals may calculate the dose and give 0.01 milligrams per kilogram per dose intramuscularly. The epinephrine helps to cause vasoconstriction, which increases the blood pressure, and bronchodilation, which improves breathing and decreases airway swelling. Other supportive measures include oxygen therapy, antihistamines, which should be given intravenously, corticosteroids, such as methylprednisolone, beta agonists, such as albuterol, for respiratory distress. I really need to stress the importance of a rapid intervention, since a slow intervention could lead to a very poor outcome. Although infections are rare, they can be present and may require antibiotics. Prevention strategies. Bees live outdoors and are often seen pollinating flowers and fruits. You need to be aware of your surroundings and need to recognize bees' nests and hives. Do not disturb or swat at the bees. Wear protective clothing and shoes when working or playing outdoors. High-risk patients should be referred to an allergist. An allergist might recommend immunotherapy. Immunotherapy will provide a gradual exposure to the bee venom with desensitization over time. This will reduce the long-term allergic reaction to bee venom. These are prescribed by healthcare professionals. If you or your loved one experiences any concerning symptoms, if you are stung multiple times by multiple bees, or you are allergic to bee venom, then you may need to seek medical attention immediately. The information in this video is strictly for educational purposes only. Only a healthcare professional can help you specifically. Dr. Camacho created the content and the illustrations, but is not your doctor.